My first delivery was an emergency cesarean section after very prolonged labour. I had major hemorrhage. This was 30 years ago, so there was much less awareness then of iron deficiency. And I think I spent the next few years absolutely exhausted. Sometime in that time, I also had a twin pregnancy and I was continuing with an almost full-time job. Looking back, if only I'd have known more then about iron deficiency, that I could have raised awareness amongst the doctors looking after me.
Actually, I was pregnant during my internship and I didn't have any rest. I was actually not eating properly. I was very tired. I was iron deficient. If only had known, I would have looked after my blood health better.
Personally, it just felt terrible. I wish I had paid attention to this more. And the whole time I was myself iron deficient and anemic, I was paying attention to my patients, giving them advice about how to manage it, but yet normalizing it myself. I feel like had I paid more attention to it, I think I could have done a better job, both professionally and as a mom.
When I was pregnant, which was 17 years ago, I did have all the symptoms. I had the fatigue, I had the restless legs. I was eating a lot of ice, but I didn't know what was causing that. I just assumed it was normal. My daughter does have a learning disability, and kind of knowing what I know now, I had all the symptoms that have contributed to that. I don't know.
For me, those signs that I wish I'd known, wish I hadn't dismissed or ignored, none of them seemed to be connected to menstrual health at the time. But they obviously were. I wish I'd have known that the broader symptoms of menstrual health and what's normal for you, what's a change for you, it's essential.
Even though I'm professional, so to speak, right, as a trainee, hematology trainee, and I was not looking after myself, running around really, I didn't realize that how difficult, that 3 months postpartum, I end up having vertigo. The whole world is spinning. That is anemic. And that I myself, again, I tell you as a doctor, we always picked up signs and symptoms for patients, but never pick up signs and symptoms for ourselves.
My overwhelming distress was I had a premature baby in the special care baby unit who is intubated and very, very sick. And because I was a doctor, everyone assumed I knew that he probably would be okay, but nobody talked to me about his outcome. I was too scared to ask. So I did cry such a lot those first few months. With hindsight, I probably could have done with a course of iron tablets.
If only I would have known, I would tell myself that don't be embarrassed by having your period. It's totally a normal thing. Nothing is wrong with you. And I wouldn't have wasted one entire day sitting in a corner feeling that you're going to die or you did something wrong or something is wrong with you. You're fine. This is normal part of your life. And keep going.
When I became pregnant, I had a best friend who was also pregnant. She died of preeclampsia. We didn't know how serious that diagnosis was. To hold my best friend's newborn baby and to feel the unfairness of the fact that I get to rock her newborn baby to sleep and she'll never get to hold him was probably one of the most devastating things in my life. A maternal death should be a never event.